midst of COVID, and that changes a whole set of things that we do and think about. This being one, but on the opportunity side, it does enable us to engage directly with a larger number of people than perhaps we might have done in our own buildings. So welcome to members of the board, members of staff, partners and stakeholders, and members of the public. Some of you are joining us directly on the Zoom call, but also some of you are joining us on the YouTube channel as well. So welcome to all of you. I hope you'll find the next hour or so helpful and instructive. In terms of the format, Matthew Hopkins, who's our Chief Executive, will do a review of the year. Vicky, Chief Nursing Officer, will talk about quality and the quality account. Robert Toole, our Chief Finance Officer, will talk about annual accounts. And then Matthew will conclude by looking forward over the next few years. There will be an opportunity for those people who have been on the Zoom call to ask questions, and we're very happy to call whatever people think is appropriate. There is the opportunity to put questions in the chat box as we go through. Most of them we'll try not to answer during the meeting, but we'll leave it till the end of the meeting, so we can bring them all together. And Richard Haynes, our communications director, will help us do that at the end. So that's what the format of it is. But just a few words from me as the chairman at the beginning of all of this. If we go to as I say, welcome to everybody. The interesting point of the slide in front of you is a team of nurses who work in bowel cancer, who do a phenomenal job for the people of Worcestershire, and they've been shortlisted for a major national prize. And in a sense, this is one of the important things that I want to stress as far as our annual general meeting is concerned. This organisation and the staff within it have gone through very difficult times over the last 4 or 5 years. We've been in the news for all the wrong kinds of things. We've had regulators intervening in what we do, but we are coming out of it with huge amounts to be proud of here. And this is only one part of it, this particular team of people. There are others as well. And the NHS in relation to COVID, and in the timetable that we are going to reflect on, which is the year 1920, 2019, 2020, not 1920, the end of which we saw COVID. And it would behove me not to mention that at the beginning, although the focus of our discussion will be on the period before that. I have to say that the staff of the hospital have done just the most remarkable job in relation to COVID. I'm always inspired and impressed by the values, the principles, but also the commitment of our staff to do the right thing for patients. But over the last few months, we've seen an extraordinary position where people have gone way beyond what anyone have imagined in the past to do wonderful things for our patients. And I'm enormously proud to be the chair of the organisation which these remarkable individuals work in. And thank you sincerely, both from myself and also the whole board, for the enormously positive things that you've done over the last period. As, to be fair, have the people of Worcestershire overall have responded remarkably well to the COVID pressure on the healthcare system, and on society as a whole. So thanks for all of that. And we genuinely do believe that we are part of the Worcestershire community. We absolutely focus on providing great services for local people. We've not always lived only but surely starting to, I think, demonstrate both to ourselves, to our population and to our regulators, that we can improve services and are improving services to the people of Worcestershire. If we look back at the year 1920, Matthew is going to talk about it in much more detail, but what I would say about it is that it's the end of the beginning. 18 months or so, we started on the journey to improve the services for patients, improve the quality of services for patients, and live within our means in a way perhaps we hadn't done in the past. And that's been a difficult journey for many people in the organisation. It's been difficult for the organisation overall. But I think we are seeing the benefits of that coming through. What you will see in our annual report is a report which reflects on an enormous amount of activity in things, services, but also a recognition that we're not making progress fast enough. In a sense, as we go forward, improving faster is precisely what we need to do. And indeed, the whole experience of COVID has given us the opportunity to move faster in all sorts of ways. For example, one of the things I think that the Acute Trust has not always done is played its full part in the development of the healthcare system, health and social care system overall. We've not always been a good partner in terms of the local services. And I think COVID has demonstrated that we can be a really good partner and that we really do want to play our full role in Worcestershire to improve services and improve the environment that people work in. So we can be optimistic about the future, but we are absolutely rooted in the reality of where we are and the scale and nature of the improvements that we need to make. Because not only have we got to get ourselves ready going forward to the potential growth in COVID over the next few months, but also the oncoming pressures that will come to the organisation for the reinstatement of services and the rebuilding of our services that we need to do that have been curtailed during the COVID period. An enormous mountain to climb. And there's no doubt in my mind that with the fantastic staff that we have, with the partnerships that we create with the wider health and social care system, we can make great inroads into that in the coming time. So what I want to do now is pass you over to Matthew Hopkins, our Chief Executive, who is going to take us through a review of 1920. Matthew.
Thank you, Chairman, and thank you for that introduction. I won't repeat it, but I'm Matthew, the Chief Executive, and this is my first, I hope, of many full years as Chief Executive of our improving organisation. I don't want to spend too much time, but I think there's a number of things that I want to talk to you about that I think build nicely on from what David's talked about in his introduction. And this picture, I think, in many ways encapsulates what I think David was talking about in the context of the role of relationships and partners. And we know, don't we, that teams working effectively together can deliver better outcomes for patients. And I think this is a picture, for those of you that don't know, this is a picture of Aconbury 3, one of our newly opened wards on the Worcestershire Royal site in the Aconbury building. And this has only been possible through partnerships between ourselves, our regulators in helping us to secure the capital monies to be able to rebuild and refurbish the Aikenbury building. Our patients who've been patient while the bed capacity on our hospital sites has been increased. Our councillors and MPs that have been critical friends to us, and clearly our staff who've been absolutely fantastic throughout this last year. And also, I think it's important to take the opportunity to thank our partners, Health and Care Trust, Social Care, and so on, who will and are making sure that these beds are used properly for only people that need to be in them, and that when a patient is safely able to be discharged, those beds are freed up for somebody else. So teamwork, I think, is something that is going to be crucial, has been crucial in this year of 2019-20, and I think will continue to be so. Next slide, please, Richard. So for me, this year that we're reviewing was very much a year of steadying the ship, but starting to build a platform for the pace of improvement that David, our chair, has talked about. We set ourselves 3 key priorities, if you like, for helping to simplify the messages for our organisation. We wanted to focus on quality improvement. We wanted to control the way in which we spend the Worcestershire pound more effectively. Work during this year in relation to our governance, better use of data and information to inform how we deliver our care, and also setting our stall out for the future. And I'll come to a little bit more of that in due course. And we also, in the face of continuing operational and financial pressures, wanted to make sure that we were putting patients first, and making sure that we were guided by what's important to our patients. And if you'll humour me for a moment, I just want to read out a message. I get quite a few messages via Twitter from patients, and this was one. Obviously, I'll pick out a positive one. But this is a lady, Jo Cook's her name. She uses and her family use our services not infrequently. And I'll read it out for you. She says, "Great care from Worcestershire Acute Trust. Alex, hospital ED today. Husband triaged, x-rayed, reviewed and plastered in 3 hours this morning. Also regular bloods taken, reported to GP to save appointment later this week. At MJ Hopkins," which is my Twitter handle, "reasons to be proud." And I think I am very much proud of the way in which our organisation is becoming very much more focused on putting patients first. And that's been partly driven by our focus on quality improvement. And I know that Vicky Morris, our chief nurse, will talk a little bit more about that as we go forward. And I won't dwell on COVID, because I think David's described some of the fantastic work that we've done. But this photo that you see here, this is Sophie Page. She's a sister in the Worcestershire ED department. And it's quite helpful that this photo's there. I mean, she's obviously geared up in personal protective equipment here. But during the winter of last year, Sophie spoke to me on a couple of occasions about how her role had become quite challenging. One of the things that the sisters were needing to do was to do a risk assessment of patients being held on the back of ambulances waiting to come into the hospital. And she described to me how at times she didn't feel, particularly at night, particularly safe in carrying out that task. And so we together worked, might have helped, and the wider organisation, the corporate functions, IT and others, really responded fantastically to help to address some of the safety concerns. Now, our aspiration obviously is to eradicate all ambulance delays, and we're making good progress on that. But one of the key things also that is crucial, and we've made good progress in this particular year that we're reviewing, is really listening to our staff, listening to our patients, and listening to our staff and responding properly to meet their needs. Because in the end, the care that we deliver is people looking after people. And if as a board and a leadership, we do not look after people ourselves, then the risk is that we'll be missing the point. Some of the, as David said, some of the performance indicators have improved, some of them have not. And perhaps, Richard, if you can move on to the next slide. This is a mixed bag. As you can see here, some of the key operational targets that are that we're measured against. Cancer waiting times improved but didn't deliver on the standard, so more work to do there. Our emergency access performance improved on the previous year, but is still some way during that year below where it needed to be. And whilst diagnostic waiting times got closer to the standard, there is still further work to be done. We know, of course, that the COVID pandemic has affected our ability to maintain delivery, but that is not a situation that is isolated to us. But those of you that joined our board earlier will know that we spent some time discussing our plans to recover the performance and waiting times for patients. 12 months. Next slide, please, Richard. And this slide is some of the other quality indicators that we focus on. I'd perhaps draw your attention to the friends and family test scores, which are for maternity, pretty good. 98% of mums delivering babies would highly recommend or recommend the organisation. And likewise for our inpatient and acute care, 95%. We still have some way to go, obviously, in relation to our friends and family responses for emergency care. And I'm sure that is partly down to the waiting times, which again, we're ambitious to improve this year. I also draw your attention to the mortality indicators, which have improved quite significantly, particularly hospital standardized mortality rate, the HSMR, where 100 is the average, and we're getting closer now to the expected levels that would be expected of an organisation like ourselves. Having said all of that, we are absolutely restless in continuing to improve the delivery of care in our hospitals. And one of the things that is going to make a big difference to our ability to do that is our focus on our people. Next slide, please. Go back one if you would. Yeah, thank you. So whilst our end of year position on appraisals and sickness absence, I think were impacted on by COVID, our turnover rates and vacancy rates for both medical and nursing improved last year. And we know, don't we, that the care of patients is always better when delivered by a substantive workforce that is recruited, developed and trained by ourselves and is committed totally to the organisation. And we will continue to do everything we can to make sure that our turnover rate improves and our vacancy rate therefore subsequently improves as well. So that's something, again, in this year, we're continuing to progress with. So during the year, Richard, next slide, we also, there was a lot of things happened, and it's easy in a kind of world where everything has been turned upside down. Developments that happened during the year, and obviously the pyramid, the refresh by the organisation of our purpose, stating very firmly that our purpose is to put patients first. The refresh of our vision, and the vision statement is all about working in partnership, all about providing the best healthcare for the people we serve, and all about making sure our staff and our teams are able to work effectively together. And the work that we did during the year and we continue to do in the context of a refresh now is around our clinical services strategy and the development of our people culture and digital strategies. So really getting ourselves organized for success was a huge amount of work, and that engaged many of our clinical teams in a way that perhaps has not happened before. We did lots of building. I talked about the Aikenbury development. We opened 99, not red balloons, we opened 99 additional inpatient beds to help to close the well-known gap between the demand for our services and the capacity, particularly bed capacity that was available for them. We had a specific focus on emergency care improvement, which I've already touched on. And we also had a continuing focus on our culture, our behaviours, encapsulated in our forward program. And we again are continuing the journey of embedding that as a continue to be compassionate, caring, and considerate to the needs of our patients, our visitors, and each other. Next slide, please. And then other achievements during the year, it seems like an awful long time ago, and of course it is a year ago when the CQC published their report on their inspection during May and June of 2019. And we celebrated at the time the lifting of our overall rating from inadequate to requires improvement. And some of the ratings jumped 2 places from inadequate to good. We saw the Kidderminster Hospital overall getting a good rating, which is fantastic. But 41 of the 79 categories that were reviewed improved. And I think you'll see later in the presentations the grids, which are very much more green and amber than I think they've been for a very, very long time. The maternity services have launched their continuity of carer. This has been a major change for the way in which our midwives work, and I commend them for their flexibility in how their working week is organised. And our staff survey, we saw a further step change in improvements in 11 areas within the staff survey. The photos here, you'll see that the bottom left, that's our radiology team at the Kidderminster site with the Kidderminster Good overall rating, and the photo on the right is the Onward Care team. And again, this is another indication of working in partnership with our local, with our council and with our partners at Health and Care Trust to really focus on making sure that only those patients that need to be in an acute bed are in an acute hospital bed, and when they can be safely discharged, they are. And we will continue to work closely to make sure that team is enabled and led in a way that delivers great care for patients. So there's a lot to be proud of during that year, but I guess my summarising comments would be that it's steady progress. What I now want to see as chief executive is that we build on that through this year, build on the fantastic work that has gone on in the organisation and across the county during the COVID initial response, as Sir David's talked about. But really, we now start to really build a really strong offer for our patients and our staff going forward through this year and into next, to really make sure that we can be proud of our local hospitals in a way that perhaps we haven't been in the past. So I'll pause there, Sir David, and hand back to you for the moment.
Thank you, Matthew. I think that was a really good and balanced assessment of where we are as an organisation going forward. But we're only we have in the organisation, and it's very important, I think, for a board to engage with the people who deliver the services to make sure that we make the right kind of decisions. And one of the things that the people who work for us consistently say, and they're absolutely right, is the crucial issue here is the quality of care that we give to our patients. It's the thing that makes people want to come to work, and it's the thing that gives them the most feedback and the most motivation to carry on the work that that they do. So I want to move now on to our quality account for 2019-2020 and ask Vicky Morris, our Chief Nursing Officer, to talk us through that. Vicky.
Okay, thank you, Sir David. And I think it's a real privilege, but also I'm very proud. I think the word pride has been used by David and Matthew, but it is a really lovely moment where you can present the significant improvements that we have made. And the quality account gives us that opportunity. But it also gives us an opportunity to acknowledge where we haven't made sufficient progress and what we're going to do about that in the current year. But I think for the development of any quality account, it takes a lot of work to collate and realise how much improvements have been made. And Jackie Edwards is going to go through some of the detail because as one of my deputies, she has led on this over the last couple of years. And it would be remiss if I then continue through the whole of the presentation without passing to her to go through that detail. But before I do that, I do want to thank our partners who've been with us on our quality improvement journey. I think, first of all, the PPF, and I know Rosemary's in the audience today, to thank Rosemary and the PPF for their support, also their challenges, but also their engagement with us on that quality improvement journey, for Health Watch and for our CCG colleagues, as well as the wider health economy. So this is a whole team approach to the quality improvements that we've made. And particularly, as Jackie will take us through, our patients who've really influenced and she will take us through the remaining slide pack, and then Jackie and I will take any questions at the end if anybody has any. So over to Jackie.
Vicky, thank you very much. Richard, if we could have the next slide, please. It's a real privilege to start off this year's quality account with a patient story. Patient stories are always so important, and they're the things that actually, as you travel through your career, you'll often hold on to significant patient stories. And as Sir David has said about our staff, when you go around and talk to staff about quality improvements, they will tell you of those important stories and what they mean to them. And so we've started this year with John's story, and I would like to personally thank John for allowing us to share this. And it's a poignant story, and it's a story that we shared at our trust board, where John came to the trust having had treatment elsewhere, and has used our ophthalmology services, and actually really found that the way that we had delivered our ophthalmology services with regards to its efficiency, its responsiveness, but actually the care and compassion, and as John eloquently has put, that courteous, personal, person-centered approach made such a significant difference. And actually, through that experience, through the engagement and through working alongside us and in partnership, John has now joined our Patient Public Forum group and is continuing to help support us in our quality improvement journey. This has remained a key theme for us throughout our quality improvement journey, of that engagement to ensure it. Next slide, please. So the key components to our quality improvement strategy, and last year we are in year 2, this year we're entering our year 3. But to take you through year 2, there are those 3 key elements that are our pillars for quality: care that is safe, care that's clinically effective, and that positive experience. And the golden thread that runs through each of these pillars for us in our quality improvement is how we can demonstrate and exhibit that caring culture, that real professional commitment with strong leadership and positive staff experience, as we saw in the slides that Matthew presented. Next slide, please. What's really important when we're thinking about that staff experience has been the feedback that we get, and throughout each area of those quality priorities, understanding the feedback, the positive. What's very important for us is sharing that feedback in real time time with our staff, so that staff experience is very clear. And here we've got four just examples to share with you, and they really do span sort of the whole ethos of the NHS, is that we're there for people from the cradle all the way through to they're reaching that grand birthday of 102, as you can see with this lovely feedback that we got from someone who experienced their 103rd birthday with us. And there are also some sad moments that we walk the journey with people. So the congratulations of the wedding that on the oncology unit, and again from the paediatric unit, celebrating Charlie's birthday. Charlie had leukemia with us, and being able to provide that cake. They're all really important elements of the quality improvement journey that we've made and captured for this year's quality account. The next slide, please. So our quality priorities that we set ourselves, that we have taken in collaboration, informing with our key stakeholders and our staff, fall into those three key areas. We have made significant improvements in all of the domains this year, and I'm very proud to be able to present this. Areas, as Vicky quite rightly says, that we know we need to improve. In the domain that care that is safe, out of the 7 here, 5 we've made significant improvements. 2 we've made improvements, but we know that we need to continue to do better in. Next slide, please. Care that is clinically effective, of those 3, and Matthew presented elements of improvement that we've had from learning from deaths. 7-day services and our local clinical audit. Of these 2, these this year have come in not significantly improvement, whilst there has been improvements. But we know that actually COVID has hit us with regards to the March data. So we are confident that we will continue to make the significant improvements we need to, but we've not reached those points that we wanted at the time of reporting this. And one of the very important areas for us is care that is a positive experience for our patient and carers. And again, I'm pleased to identify that we've made significant improvements in these areas. Next slide, please. The participation in clinical research, the sort of science and evidence-based practice for us going forward, again has been a key area for us to report to you for our quality account. It's continued to see a 14% increase from 2018-19 in participation, with 710 participants enrolled into the interventional studies. Of those that we've recruited into the 58 studies across 15 clinical specialities, as shown here in this table, 3 of these studies were commercial and 17 were new studies. Next slide, please. But alongside the science that we very much drive through our quality and our quality improvement, there is an art to our practice. And it's a pleasure to present these 4 areas for you today that have been key features for us in driving that quality improvement. For patients here on Ward 1, in the top of the screen that you can see, music therapy and the arts have played a significant role for us, particularly for our patients who find themselves in strange environments, those that with learning disabilities, dementia, as examples. We've got the team down at the bottom, as Matthew mentioned earlier, our continuity of carer with regards to Team Ruby, which is in Evesham, and that's played. These are our new mums to be, and the delivery of quality improvements through our service delivery is really made a difference into this area. In the top right hand of your screen, you will see how the importance of delivering quicker services in a timely way through innovations. Here, our cardiac service, heart monitors. We can't go without saying for the year that actually this is prior to COVID. our infection control and getting our infection control practices right has been a key priority. And thankfully that we focus very early on this as a priority, because actually that was prior to COVID, and the successes that we had achieved through education and training of our staff. And in the bottom left-hand corner, you'll see that we held a conference on infection control and prevention in April, where we wanted absolutely to ensure that we were getting those basics right. Next slide, please. As Matthew alluded, we had our CQC inspection, and the ratings across our 4 hospital sites you can see here, and where we had moved from a position of inadequate to requires improvement. It was also, we were inspected across the key areas of medicine and care of older people, surgery, children and young people, outpatients department and diagnostics, and improvements could be seen into those areas. Next slide, please. This slide here just identifies by site for you the progress that was made into those areas, and the areas that I've identified for medical care, surgical, outpatients, diagnostics, children and young people. And as you can see, the areas of green are really demonstrating themselves, but also really importantly is for diagnostic services were rated as outstanding. I can't share with you strong enough the impact that this had for our staff and our staff experience. And if you could move to the next slide. I don't apologise for sharing some of the same slides that Matthew did with regards to the celebratory event that we had. And actually, it was one of the proudest moments, I think, for my career of actually sharing that with the staff and seeing the impact that this had for them across these sites, and how actually infectious it was with regards to that sense of pride, passion, commitment, and striving for the next level of going from sort of where it requires improvement good to actually outstanding. Next slide, please. We were also received an unannounced inspection in January for our urgent care pathway. And the emergency departments at the Worcester Royal and the Alexandra Hospital that were inspected, actually, whilst no safety concerns were raised on site, we did recognise that we needed to make significant improvements, and as identified by the CQC. And under Section 31, we've been working from that point on to ensure that we've got safety, quality for the patients that are coming through this group. Next slide, please, Richard. And therefore, the work streams that were in place have been delivered through our Home First programme and continue to be a really key area for us to focus on. We've got key work streams that very much focus on ensuring that on a day-to-day process, patients from the start of their journey in the emergency department through to discharge to their place of residency is as smooth as it can be. And through the work streams that are identified on the left-hand side of this slide shows you the important areas that we're focusing on. The areas that we've also pulled through into our quality account for next year, such as frailty and hospital-acquired functional decline, are going to be key in ensuring that those progress for quality are maintained. Within the emergency department, as under the Section 31, the team have been working tirelessly to ensure minute to minute patients are receiving quality of care through the various processes that are identified on the right-hand side here. The picture that we've got at the bottom is just one example, and this is our TNO ward who received their fruit basket because what they had done is achieved and continue to achieve throughout that area discharges as early in the day as they could do. Next slide, please. through any journey at any point in time, you continually learn as a professional. And in October of last year, Vicky received a complaint in from a daughter whose both parents had been receiving care in our hospitals. And we recognised very quickly that that care was not to the standard that we wanted it to be. And therefore, Vicky commissioned a review, a very important review for us that gave us a degree of deep insight into each ward area and where we were at with regards to what we term now as our fundamentals of care. Through learning from that experience that the daughter shared. And it was a real privilege that through sharing of that experience with our ward managers and our matrons, and you know, they're difficult stories to hear, we were able to, through collaboration and hearing of that story, the ward managers and the matrons were very key that we continued this Fundamentals of Care programme. This slide identifies some of the areas where we had identified where we needed to gain further assurance and where the important collaboration with our ward managers was going. Please. So from that review of the fundamentals of care for each and every patient across the ward, it's become key for us in not only looking back over the past year, but also looking forward to what are the enablers for us for year 3 with our key quality priorities. And we have kicked off our Fundamentals of Care programme that is going to be our focus for year 3. And the enablers within that programme being our Home First, as I referred to, but also the training of staff through quality improvements and quality improvement strategies from the ward. And that links very closely to our fundamentals, our Path to Platinum accreditation programme. And this programme, which we started last year, but unfortunately was paused for during COVID, we have now picked back up again, whereby through an accreditation processes, through our quality indicators, wards have a very visual sight on where improvements need to be made and where they are doing extremely well. And the process of sharing where they've done well across wards is key. And then our volunteer strategy. And as I referred to early on in the presentation, working in collaboration with our stakeholders, and thank you to Healthwatch, to our HOSC, and to our Patient Public Forum members. Actually, we have developed a volunteer strategy through learning of what they feel they want from us as a trust, how they can give back to the trust, and what that structure and process needs to look like. And that's also going to be key for us for next year. Last slide from me, please. And so here is our quality priorities for year 3 that we have brought together and are working on as we speak, that through active engagement and collaboration are going to be key for us in continuing our journey of quality improvement. I won't go into depth with them. They're there for you to see of how we've travelled to get to this point. And I look forward to presenting to you the outcomes of these at the end of year 3. I'll hand back over to Vicky.
Okay, thank you very much, Jackie. And I think a quality account and the publication of a quality account is not to be underestimated. And Jackie has lived and breathed this with multiple editing stages. And I thank her very much for that. But I think on behalf of the organisation, thanking all of our staff, clinical teams, because if you spoke to any of them, they would outline their pride in the achievements, but also recognise what we've got to do more and recognise that our quality improvement journey is an onward one, and they're very committed to that. And I think that's what we get a real sense and why we're so proud of what we've presented today. So I'll hand back over, David, for any questions or any comments.
We'll take all the questions at the end. So thanks for that, Vicky and Jackie. And I'd add my thanks to the work that Jackie does, not only in pulling things together like this, but also leading the improvement of quality in the organisation as a whole. So thanks for that. We really do appreciate it as a board. So on the quality side, hopefully people feel that we've had a rounded view about what we've achieved. We're really proud of what our staff have achieved in relation to improving quality, but we're not kidding ourselves that there isn't still a lot of work to do. Which brings us on to the issue of finance. And this organisation, for a whole variety of reasons, over the last 5 or 6 years, has developed a deficit, a significant deficit. That does affect inevitably the rate and the ambition that you might have within it. The board is absolutely committed to tackling this issue. It's a significant £80 million issue. We're absolutely committed to tackling it, but we want to tackle it at a rate and in a way which protects the quality of services that we provide. Whilst we're committed to dealing with it, we'll deal with it in a timely way that suits our organisation. But there is a lot, and I want to pass us on now to Robert, who's going to talk us through the financial accounts.
Thank you, Sir David. Hello, I'm Robert Till, Chief Finance Officer, and as David says, I'm just going to provide a brief overview of our financial performance and governance for the last financial year, which, just a reminder, as we all know, ended as we all entered into lockdown, and that did have a level of impact in terms of the accounts that I will cover. If I could have the next slide, please. Thank you. So financial performance, 3 main financial duties that we have to achieve. One is making sure that we appropriately spend up to our capital resource limit, that we don't exceed our external financing limit, and we do have a statutory break-even duty, but as we've identified, we've broken that for a number of years now. But as David has said, our aim is how do we start to improve and drive that deficit down. In terms of our performance then, we did do better than planned, although let's recognise that we've got more to do in terms of identifying, delivering and resourcing our productivity and efficiency schemes going forward. But for the first time in a number of years, we improved on the plan that we as a trust had submitted and signed up to. In terms of our cost improvement, we identified about £12 million worth of and delivered plans. We'd hoped to do at least 13.7, but we still, despite that, managed to achieve the external plan. However, move on to the next slide. Whilst we were £1.3 million, next slide please, thanks Richard, ahead of the plan, and that was consistent with our forecast. As I said, we had hoped to achieve more. That was pretty much impacted by a number of things, particularly the additional increased activity in our urgent and emergency care activity. And that was exacerbated by the fact that in order for us to provide activity and resource particularly our beds, we did have significant agency premium costs, which wasn't helped by some poor patient flow across the health and care system, which obviously we've been managing to or helping to address further through the Home First Worcestershire schemes with our partners. On top of that, what we do obviously have is more challenge to identify and resource, and as I said, deliver our productivity schemes going forward, which is a key focus for us as a trust board. If we move on to the next slide, this basically just talks about our activity and contract income position, and you can see from the breakdown on the top left hand side is our total activity, and that is forever that comes from, but you can see overall our urgent and emergency care non-elective activity was significantly up, particularly to the February. Obviously the last 2 weeks of March significantly impacted pre-lockdown, but that is the key things that we've got to make sure that we manage that particular activity going forward. The right-hand side is the activity with our Worcestershire CCGs. So it just shows the difference in between what happens from local but actually out of area that we consider. So prior to March, we had also, as you can read from there, day case activity above previous levels. And a lot of that was also down to the fact we had a significant endoscopy recovery programme, and it invested just over £2 million, £2 to £3 million in providing extra activity for that. We also saw, whilst our electives were similar to the previous years, outpatients were slightly down on volumes on a like-to-like basis. We had been doing a lot of work on ophthalmology pathways, though, working with the community and other partners. So that's important that this isn't, this is also about pathways and for the benefit of our patients. But we did see that our non-elective activity and ED attendance is significantly above 18-19 levels up to February. Moving on, balance sheet. So, as we know, the Trust has a very significant, at the end of last year, accumulated deficit of over nearly £350 million. We did make sure that we managed our cash position, though, so that was good news to the end of the year. And we continued to invest £13.7 million last year in our infrastructure. We also received financing for our revenue support, that's for the deficit, but we continued also to secure financing that allows capital investment in our hospital sites. And that's really important because, as well as internally generating resources, what we are trying to make sure is that we can invest in our emergency care systems, our cyber security, and we continue to invest in Akenbury East ward schemes, as well as replacing clinical equipment and big investment and ongoing investment in our IT systems and infrastructure, as well as maintaining the estate. So we're not short of able to secure funding, which is really good, and continue to invest in our equipment and estate, as I've said. Just move on to the annual audit, because that's important, because today obviously we accept and approve the annual report and accounts. This slide's in partnership with our external auditor, Grant Thornton. So this is very much about our financial governance. Recognise in producing the accounts, extremely challenging period, as everybody was dispersed to home working and various other places. We did deliver the year-end accounts, and that was recognised as particularly challenging. However, as I mentioned before, the impact of COVID did mean that the auditors weren't able to do all the testing they would normally do in terms of our balance sheet, which did result in a limitation of scope and a qualified audit opinion. However, it's important to recognise that's not due to any control weaknesses or governance failures, and the accounts have been properly prepared in accordance with all accounting standards, and the annual report meets the Department of Health and Social Care requirements consistent with the accounts. And some very good proactive engagement, good quality financial statements produced. So that's the recognition from Grant Thornton. We've had Jackie has presented the quality account position. They're not audited last year, particularly due to the COVID-19 errors, but again, that shows some of the good work we've done. In terms of value for money, I think it's still challenging. The auditor did recognise that improvements had been made through 1920, but we need to continue to reflect those in our improved operational financial performance going forward. And in terms of future considerations, it's important that we address the required improvements in CQC, make sure that we manage and deliver our productivity programme more effectively, and also make sure that all recovery actions are fully implemented and we get an improvement in our performance. So I said the accounts and report are more than just about the money, it's about making sure we can provide good patient care going forward at value for money. And finally, last slide, just moving into 2021. We know we've got a challenging outlook. The Trust annual plan was, of course, considered and agreed at the Trust board before the change in the financial regime, and we set ourselves a target deficit of no more than 78.9 million, but we are hoping to do better than that. But it is important as we do that we also can look and continue to drive improved productivity and efficiency program, notwithstanding we're working into a different financial regime of pretty much block contracts at the minute and fixed income over the rest of this year. So talk about the normal planning and contracting process being paused into this year, and that means we've had a guaranteed income which was originally just for April to July. That's been kept through to the end of September. For the next 6 months, we're going to be very much looking at how we work as a system and only spending but delivering more patient care within a limited amount of funds for the next 6 months. And those arrangements for October through to the end of 2021 are going to be based on a similar architecture the first 6 months of the year, but very much, as I've said, a greater focus on system working and restarting particularly our elective and our cancer activity, delivering the best we can for our patients. And that's a summation of the report and accounts there, Chairman, if that's all right.
Right then, thank you. Thanks. Well, just let me get this right. Thanks very much for that, Robert. And I don't, you know, the numbers don't lie. And this organisation has been living with beyond its means for some time. Yeah. And you can see the consequences of that in all of this. The good news is that the accumulated money that Robert talked about earlier on, the Department of Health has deemed that that basically those numbers have been wiped off the agenda. We're now focused entirely on the matter of the delivery of our revenue, total amount of revenue. As Robert says, we're committed to making a routine getting on with it. But not a great picture, I think, for the organisation. But I think hopefully you would agree that there are some improvements there that we can now work through for the organisation going forward. So finally, let's go back to Matthew to talk about the future.
Thank you, Chairman. Looking forward, it always feels a little bit strange talking about the year ahead when we're already several months through it. But I think for me, the messages remain the same as they were for last year that we've reviewed, really, which is quality improvement, making sure that the Worcestershire Health and Care Pound, as Sir David, you've just pointed to, is used as effectively as possible, and making sure that where money is spent, it's spent in the best and wisest way. And the third key area is being absolutely focused on being organised for success. I think on the quality side of things, we absolutely is something that is imminent, but we also are now planning a course for getting to a good quality rating, albeit in the context of a new world order for all of our partners and regulators. I think in terms of the building on the progress and the controls around how money is spent, we spend 70% of our income on our greatest asset, which is our staff. And we absolutely want to continue the good progress around staff engagement, reducing turnovers and improving staff experience. And we want to make sure that alongside that, our patients are more involved in the development of services, the work that we do, and that we use patient feedback more effectively and openly and transparently than we have before. I think in the context of being better organised, I think the continuing focus on integrated care across the county is something that we absolutely want to be and will be closely involved in. And our partnerships with our tertiary centres, so our specialist providers of healthcare in Birmingham and Coventry, are going to be key relationships for us going forward. But also with the ambulance service. Next week, the ambulance services, West Midlands provide the 111 service next week in our county, particularly in the south of the county. If patients walk into our ED department on the Worcestershire Royal site, we will be expecting them from Monday to have contacted 111 first. And obviously our relationship with the ambulance service is going to be crucial, because if the ambulance service then says ring an ambulance, that's defeating the object. We want the services to be the right services for our patients. And that's going to be crucial, I think, in the way in which we organise health and care across the county. Next slide, please. This is a busy picture, kind of the road. I think I suppose it's the M5, there's lots of things that are going on. As you can see, the big sort of targets of response, restoration, recovery, and reset are all about the COVID response, and these are nationally driven. But some of the local elements of our focus, 7-day working, moving to improve our hospital at night provision in our hospitals to make sure they're as safe as possible, mobile and remote working, making sure, for example, our consultant radiologists are able to read scans and report on images more effectively. All of those services, acute hospital services are delivered. So this really is describing a picture of significant change, both for patients, the public, and our staff. And also, it also indicates, you know, underneath all of this is going to be quite a lot of change in the way in which our buildings are used, and the introduction of different models of care are going to be absolutely part of the way in which we deliver care. And capital monies that have been provided, again, by regulators of the department are going to be enabling us to improve our technology, improving our responsiveness of our services. But what isn't going to change is our absolute focus on our purpose of putting patients first. So I think I've said already, we're restless to continue this improvement. We want to now plot a course towards getting to a good overall rating. But really what we're saying is, with all of the health and care services across the county, we want them to be the kind of services that we would absolutely expect to be provided by any great hospital, providing the best healthcare for our loved ones. Because many of our staff and many of our partners actually are users of our acute hospital services. So for me, better never stops. And I've got a thank you and an ask to kind of finish off. Firstly, again, just to reiterate my thanks to all of our staff, the public, our patients, our partners, regulators and stakeholders who've played and will, I know, continue to play a key role in making sure that services are the kind that we can all be proud of. But I've got an ask in the context of COVID, if we can use every opportunity that we have to remind people to be compliant with COVID guidance, whether at work or at home. I want to take this opportunity, this platform, to remind everybody there is no excuse to not have the flu jab. We're entering flu jab season. That's a personal responsibility I think we must all take. And something dear to my heart is Organ Donation Week. If I can take the opportunity to ask anybody who hasn't yet spoken to their family about their organ donation wishes to do so, because that will make a massive difference to the lives of thousands of people that are waiting every day for a transplant. And we heard this morning at our trust board meeting that just under one person a day, let's say one person a day dies on a waiting list waiting for an organ transplant. Last slide, Richard. So David, back to you. Unfortunately, I haven't been able to provide any dancing elephants throughout part of my presentation, but we do at least have a photo of a celebrity, Vicky Hall, who's one of our staff nurses based at the Alex, who was a big star on Casualty, which feels like a bit of a busman's holiday. And I'll pass back to you for managing any questions. Thank you very much.
Thank you, Matthew. You know, I hope you'll join me in thanking the present people who presented today. It's been such a remarkable journey that we are on. It's often quite difficult to get perspective when you're in it, to see where you are, but I think hopefully everyone can see that we are making improvements. This is an opportunity, I think, for people to ask questions if they want to. It's not mandatory, but it'd be nice if you did. While people are thinking about the kinds of questions they might want to ask, can I just confirm with board members that the minutes of the meeting that were circulated from the last AGM are a reasonable and a correct reflection of what we said and did there? Yes, can I get your agreement to that? Thank you very much. Okay, as they say, in the circumstances, any questions? Richard, anything I should be responding to?
David, no, it's been very quiet on the chat.
Okay.
Either everybody has had all their questions answered or they're storing them up for now.
Right. One of the things that people say about me is I can do silence, but I don't really want to. And for those of you who wondered what Matthew was talking about with dancing elephants, we had enormous plans for this year's AGM, which would have involved live animals, dancing, all sorts of things. But sadly, we had to cancel it all because of we've had to do it over Zoom. I can't see any questions. Excellent. There's a question from Robert Toole. Excellent, Robert.
Rosemary had a hand up too.
Yes, I've seen Rosemary. I caught, but it was the thing that struck me was was Robert said we have to approve the annual accounts. That's all, and I'd missed that, which just seems to be, you know, the obvious thing for a chairman to do. Can we approve the accounts as well, please? Yes, thank you. Thank you. And Rosemary, you're in my top right-hand corner, but I'm sure you're everybody else. If you've got a question or a comment to make, please feel free.
Well, both a comment and a question. The first comment is to congratulate the Trust for having done a fantastic job during the year, and particularly with COVID in this year. And just to show some of the improvement, I was on a safety walk around at the Accident and Emergency Department at the Alex yesterday with Vicky, and it was actually fantastic to see the progress that's been made and the fact that they got the ambulance time completely down to the 15 minutes transfer of patients into the department, which was really very impressive. My question is, I'm concerned about the 111 system, about being used for access to our accident emergency and our MIU departments. How are we going to monitor that this is going to be good for patients?
Thank you, Rosemary. This is an important, in fact, a very important question that Rosemary raises. There are big changes afoot in the NHS in relation to the way in which A&E departments operate going forward. By the end of the year, the expectation is across the country that people don't. Obviously, if you're an emergency, you're an ambulance, and you come in, that's straightforward. But if you're coming on your own steam, there's the indication is that you're meant to ring 111 before you come, so that we can organise a proper appointment or arrangement or an alternative for you to avoid you coming to A&E if you don't really need it. But also, if you do come to A&E, you can come at a specific time where you can be assessed or treated. And we're in Herefordshire and Worcestershire, we're one of the first hospitals in the country to start to trial it. This is a major change, I think, in the way that healthcare is delivered. And I think you raise a very good point about monitoring and how we're going to make sure that we're doing the right thing and all of those sorts of things. And I don't know whether, Matthew, you want to take the first opportunity to talk about that, or ask someone else to.
Yeah, thanks, Chair. I think the crucial bit, Rosemary, is absolutely the way in which we work together with our partners at the ambulance service and in primary care. Because we've absolutely got to get it to a place where we are cited on any quality impact that affects people if they're redirected, and that working together enables a constant review of the decision making that is being taken by the 111 service, because clearly what the YMAS call handlers will be doing is that first clinical triage, and then they will be directing, as they do now, directing patients to either to a GP appointment or to the hospital. But the intention is that there will be 10 or 11 different alternative pathways where patients are redirected to keep them away unnecessarily from an emergency department. But this is going to require a very close collaboration between ourselves, general practice, and the ambulance service to make sure that any examples of misdirection are appropriately addressed and safety is maintained. But we already know from local audits that a number of patients that are coming to our hospitals are not appropriate to come, and this is intended to make sure that people are treated in the right place at the right time by the right carers. But it's going to be constant vigilance, but the way in which we work as an integrated care service is going to be crucial.
Thank you.
Yeah, and just to reinforce that, and also we're going to be very sensible about this and patient focused in the way that we do it, and putting a lot of time and effort to make sure that people get to the right place. Okay. Right. Well, I'll wind the AGM. Oh, yes. Thank you very much for everyone who's contributed. Thanks for your time and effort for coming to listen to what we've got to say, and for those who presented. Just to reinforce the position that Matthew said earlier on, many of our plans going forward will not come to fruition if we have a further spike of COVID across Worcestershire. I know the people of Worcestershire have responded very well to the requirements, but the requirements remain: washing your hands, safe distancing, and I think the new rule of 6. All important things for us all to do. And if we do that, we should stay safe and we can avoid the worst of this horrible disease, and in particular help us manage it in the hospital overall. So thank you very much for attending, and stay safe. Thank you.